Okay. I don't speak that loud, so it's best if it's on. So good morning. I appreciate you guys hanging out for the last morning. I know that, at least for myself, I had to pack and then get myself ready and then get here, so it's not super easy, especially if you got little ones, because you also have to wrangle them and get them in their clothes, and that's always super fun. So having two of my own that are way bigger now. So I will talk about mental health and MSUD. I do want you guys to understand, though, that some of the limitations and considerations that are present for MSUD patients are also actually true for a lot of just our general liver transplant patients. So some of the things that we'll cover are not just specific to MSUD. It's been observed and seen in MSUD populations, but I can't honestly tell you how I could tease apart, right? What might be related to solid organ transplant, what might be related to MSUD, and what might be related to other genetic and familial, social, cultural factors that the kids are embedded in and develop in, right? And so since I'm a pediatric psychologist, I apologize to those who are looking for more adult information. I will do my best. I do have a little tiny bit of adult information, but most of the information I have is pediatric in nature because that's what I work in. I work at a children's hospital. So, yes, sir. So the population that I see specifically, I do see people as they come in pre-transplant before they've had, obviously, liver transplantation. So I do have some information in that regard, and we can discuss that. That's not necessarily on the slides. But the majority of my data is post-transplant. And the reason for that is because that's the population that comes to children's. So Dr. Strauss is in a different situation, right? He gets the whole population. We primarily get the transplant patients. You know this part. I think everybody here knows how rare MSUD is, how classical type is the most challenging of the types as far as maintenance of stability in the BCAAs, and you know that diet restrictions are necessary in order to maintain some stability for the patients. We also understand that any illness, injury, or other issue that can arise can lead to a crisis episode. And more instability obviously leads to worse outcomes. And that is true regardless of how long between your first crisis episode or you being diagnosed and transplant, or between or just lifetime. The worse, the more instability you have, the worse the outcome, and it's progressive over time. Clearly, there we go. So MSUD is very complex. I am not a neurologist, so I can't tell you all the specifics, but basically when there is an imbalance of the leucine, isoleucine, and valine, it creates deficiencies within the brain in different ways. And the ways in which it does that is that it can lead to cell death in the brain. It can lead to minor structural changes, and I'll explain a bit more in the next one. So one of the ways it does that is that when we create other metabolites, other molecules in our brain, we are also creating aspects of how we understand and absorb information, right? So some of these, like glutamate, can affect whether or not a message is transferred between one cell and another. And creating those connections between cells and how strong that connection may be or how weak that connection may be may then affect your functioning, both mental health, but also cognitively. And later down the line, also in your executive functioning capabilities. It affects the way that energy may be stored within the cell and or utilized. And so the same way that you see some of our MSUD population say that after a transplant they might feel more energetic and it is easier for them to engage in activities. This also presents itself within the brain itself and the energy that the cells utilize on a day-to-day basis. And most of our calories and energy actually are utilized by our brain on a daily basis. And so it is very important how those messages transmit, how the energy is used, and how quickly those messages get from one place to another, right? And so our brain has basically highways between neurons, and the highways have kind of like padding around them, right? But it's like slick padding, and when some of these metabolites are off, that starts crumbling off, and the messages are either slower to get there or never get there. So the more instability, the more difficulty with this that happens. And what you then see, as I mentioned, is that you see changes in mood, maybe in a lack of instability in mood, because all of those things then affect systems within your brain that modulate behavior, that modulate general functioning, that modulate emotion. And because of that, if there is any glitch, shall we say, in the process, it can lead to a problem later on. Now, how big of a problem, that is quite variable by individual. It's not cookie cutter. I mean, I think everybody in here knows that MSUD is not cookie cutter. It would be way easier to treat if it was, right? Like, everybody would know that A happens, you do B, but that's not the way it works. So what this means is that your brain chemistry can really affect multiple aspects of your day-to-day life. Anything from like figuring out how to do a task to feeling comfortable in doing that task, or being overly anxious when having to perform that task, or forgetting to perform that task. So there's a lot of different things that can occur, and we are very complex individuals. The way that our brain is functioning even when we're not thinking about it, right? Your brain is currently telling you to breathe. You're not actively aware of that. It's actively probably digesting your breakfast, and you're not telling it to do that. It's just automatically doing that. But those things those are within a specific region of your brain that it's usually not affected by MSUD, right? But the other more advanced components of your brain with reasoning and understanding and absorption of information and maintenance of memory and your ability to hold information in mind while you're manipulating it. So that means, like, for example, if you have to do somebody tells you, okay, I need you to do these 3 things, and you start with one, you have to maintain the other 2 in your brain, knowing that you have to do them. Or you write them down, right? That's a way to get around that. But if you keep it in your brain and there is an issue with your attention, you might not encode, meaning you don't absorb that information. So you finish one and then you sit there and you go, geez, what was I supposed to do now? I know they said 2 more things, but I don't know what I'm supposed to do now. Now, mind you, this also happens with age. I will attest to that. But it should not be happening necessarily to a 12-year-old. And I should point out that what they have found more recently is that if an individual is picked up as having MSUD after they have experienced encephalopathy and brain edema, there's a greater likelihood not only of cognitive deficits and developmental deficits, but it's a greater likelihood of mental health issues down the line, okay? And you can't always, well, you can't typically pick up anything like depression or anxiety or even ADHD in a very, very young child, like a 1-year-old or a 2-year-old. You can't really necessarily assess for that. You have to wait for some of these until they're a bit older. They can actually tell you how they're feeling. You can look at emotional dysregulation, which is usually a predictor of later emotional regulation, but it's not a one-to-one correspondence because it is affected also by the emotional regulation of the parent when they're very young. So here are the things that we have observed throughout the years. I covered some of that. There's speech delays, developmental delays. It's, again, not every individual. Possibility of lower educational attainment or professional attainment. I will also tell you that I have a 23-year-old patient that I evaluated early on in my career. So they were a little tyke when I saw them the first time. That kid is brilliant, highly advanced, will graduate with an MBA probably within a month, okay? So I can't guarantee you anything, which is the difficult part, right? I'm standing here talking to you guys, but I can't tell you this is what's definitely going to happen with your child. I don't have that kind of roadmap, but neither does anyone else with a typically developing child, right? I couldn't have predicted my own kid's trajectory completely, and I'm their mom. And they're typically developing, allegedly, right? So there's always some uncertainty that goes along with this. In general, cognitive functioning does tend to be lower. However, there are those individuals who are very high achieving, very high functioning, right? Just like there's variance in the population. The population, most people are in the middle, right? So when you look at cognitive functioning, it's what we call a bell curve, which means it goes like this, right? And the middle is where most people fall. The extremes is where fewer people fall. And that means that very low functioning and also very high functioning are fewer of the population than the general average population. MSUD also can have a little bit of a bell curve, but most of our populations that we have assessed are a little closer to middle low than middle high. And so that's what we typically see. We also see more ADHD in this population. Attention's a big thing that comes up a lot with some of the kids that are now in school. And executive functioning is something that's actually not really fully online for any of us until we're in our mid-20s, okay? And that's just science, because your frontal lobe hasn't, as I like to say, fully congealed. And so you're still making potentially poor decisions in your early 20s because not everything is online. So anybody here with a 20-something-year-old, take heart. There's still room for improvement. That's not supposed to be the end. Uh-oh. Oh, here we go. Okay. Sorry, guys. Obviously, there we go. Over a lifetime, with and without transplant, there's a higher incidence of depression and anxiety in individuals with MSUD. And actually work that was done with Dr. Strauss showed a very high prevalence by mid-30s of depression and anxiety. in the work that I'm doing with younger kids, I tend to see anxiety more than depression, in all honesty. And I think there are not generational per se, but decade changes in how the kids are coming along, to a great extent due to nutrition, right? So formula has evolved, the availability of low protein foods has significantly improved. There's a lot of changes from when all this work initially started till now. And it is easier today to adhere to a low protein diet and do that with some variety in your diet than it was 20 years ago. Is it easy? No, it's never easy by any means, but it's easier than it used to be. So this is skipping around quite a bit, but that's okay. So one of the things that we have seen with liver transplantation is that because it is highly unlikely, we've only had like maybe one episode that Dr. Mazariegos presented about yesterday due to a variety of different medical factors, but there are no crisis episodes after liver transplant, right? So you don't have a situation where you're gonna go into crisis episode, you might have brain swelling, you might have additional loss of function. You are more stable after a liver transplant, your levels are more stable, and therefore when I see a patient and I assess them pre-transplant and then I assess them 1 year post-transplant, I do that consistently, and then I see them yearly if possible. And that's true for all of our patients, not just our MSUD patients. If they have no negative events between the time that I assess them for transplantation and the actual transplant, and they haven't had crisis episodes, they haven't had any significant instability during that period of time, the likelihood that their cognitive functioning will remain stable is high, right? So you won't see a downturn in their functioning if they have remained consistent. If there has been a crisis episode, if there has been high instability, then we can see a downturn in IQ. And IQ is something that once it's affected, it's not quite so flexible in regaining because it's more of an aptitude and it's less of a skill. Now there's lots of different ways to assess IQ, and some of it is cultural in nature, right? Not all cultural groups score exactly the same on an IQ measure, but the majority of it is supposed to be more of an aptitude sort of functioning. I do consistently hear from our patients that have had liver transplant that their quality of life has improved. A good number of our population, a lot of young men tell me I can be in the field forever and I don't get tired. And I'm like, great, wear sunblock because the meds we're giving you make you more prone to cancer. So, so wear that sunblock. But they're doing much better as far as their energy is concerned. They don't have to worry about carrying their formula with them. They can eat whatever might be available or decide not to eat if they want to skip it and just eat at a later time. So that fear is gone, which makes them feel a bit more relaxed and a little bit less concerned, which also leads to less stress, which is a feed into anxiety. I went over some of the mental health burden. What you can see here are the differences, right? So the green bar is transplanted patients. The orange bar is diet-only patients, and this is lifetime, meaning from the time that they were born to when we assess them. And then the blue bar is the general population. So that's the proportion of individuals in the general population that experience anxiety and or depression. That's as of 2025. I think for the general population, our numbers are shifting, unfortunately, due to a variety of different things, but in the US, it is shifting a bit. But you can see that, unfortunately, in MSUD, you do have a much higher likelihood of experiencing symptoms of these than someone who does not have MSUD. Now, that's not true if you compare to other inborn errors of metabolism, transplant patients in general, individuals that have cancer, individuals that have any other chronic medical condition. The rates of depression and anxiety are higher for those individuals than for the general population. So if you're comparing to a completely healthy sample, that's one thing. If you're comparing to other individuals who also experience high level of medical need, then it's not so disproportionate in the two. Why does it keep doing this? Sorry. Okay. So I went ahead and looked at some of the data from the last 3 years that I have gone to the Clinic for Special Children. I go once a year with the rest of our transplant team from Pittsburgh, and during that time, I assess the kids based on that data, and I did not look at individuals that were born before the 2000s. The last 3 years, I have assessed a couple of people that are post-transplant that were adults at the time that they came to transplant, but I focused primarily on the kids and individuals born 2005 and forward. And out of those, there were 17 individuals that I had data for. 6 of them, or 4 of them had ADHD only. 2 of them had ADHD plus anxiety. 2 had anxiety. 1 had depression. 2 had developmental delays, so they needed speech therapy, occupational therapy, physical therapy, those type of supports. But the majority really was intact. They were okay. They didn't need OT, PT, speech, or support in school. They didn't need medication for ADHD or for anxiety or for depression. So they were, at the time I saw them, functioning quite well and doing quite well. And I will have more data later in August when I go again, which is coming up, but this is what I have for now. So you can see that the proportion, I think, and I mentioned this during Dr. Mazurego's talk yesterday when someone asked a question, which is, I think as there is better detection and as people are more stringent to their diet, you see fewer deficits in the populations that are coming along. Also, medicine is better, right? So people that were getting nutritional advice 20, 30 years ago, maybe 40 years ago, is quite different than maybe what they are getting right now. And so the level of impact on the brain is maybe significantly lower at this point than it used to be. Liver transplantation corrects the peripheral, meaning blood primarily, amino acids. It corrects it. We are not sure if it corrects it in the brain, right? But the brain, it only basically translates to a less than 20% of what is excreted in the body and what is used in the body, and it's not that particular concentration that affects your cognitive functioning. It's all of the concentration in your whole body, right? So, which is why we see the stability, because once you have a liver transplant, again, no crises, you're not seeing things like skyrocket and then lead to more difficulties. And the last thing I wanted to say is that basically we are all comprised of multiple aspects of our environment, our families, the resources that are available to us, the investment that people make in us. And so when you look at potentially yourself as an MSUD patient or your child as an MSUD patient, you got to remember that, yes, there's the MSUD patient portion, but really you're your own individual. You're your own person. This is your kid, and they're that first. And even though this takes up a lot of room in everyone's brain, they're MSUD second. They're not first. That's not first. And so part of my job is to invest in these kids, to let families know, okay, I see this deficit. Let's make sure we plug these things in so that we can improve how they're functioning. I see them struggling with a mental health condition. Let's try and figure out to get them treatment so that they are feeling better and they do better. And these things, I know we're in MSUD conference, but all the things that we talked about affect the population at large in different ways and at different rates. And so you have to, that's why I think of the patient as not a patient, but a person, because that's who we're treating, at least from my perspective and the perspective of my colleagues, right? We're treating an individual, and we want to provide the best that we can for them, regardless of what may be present and what we may need to remediate or help with. Now I am done. So